Hello everyone, I'm Dr. Linda, and welcome back to my YouTube channel. Today, we're talking about a patient who believed his symptoms were simply the result of getting older, being tired from work, and carrying the stress of everyday life. But beneath those seemingly ordinary complaints, something much more serious was developing. By the time he arrived at the emergency room, several warning signs had already been present for weeks. What we eventually discovered was a condition that affects millions of people worldwide and can lead to life-threatening complications if left untreated. As doctors, we often see patients who gradually adapt to worsening symptoms without realizing how serious they have become. This case serves as an important reminder that some of the body's most significant warning signs can appear slowly and quietly. That's why regular checks are very important. At first, it sounded like a routine complaint of fatigue and breathlessness. But as we listened more carefully and examined the patient, it became clear that his heart was struggling to keep up with the demands of his body. If you enjoy real hospital stories, medical education, and behind-the-scenes insight into how doctors handle real-life cases, subscribe and join us as we explore the realities of medicine one patient at a time.
The patient was a man in his late 60s who arrived at the emergency department accompanied by a family member. He appeared exhausted. Even walking a short distance from the waiting area left him noticeably short of breath. He reported feeling unusually tired for several weeks and had recently noticed swelling in both legs. What concerned him most was a rapid increase in body weight despite no major changes in his eating habits. He also mentioned that he had become increasingly uncomfortable when lying flat in bed and often needed extra pillows to sleep comfortably at night. As we brought him into the examination room, the atmosphere shifted from routine assessment to focused investigation. Something wasn't adding up. His vital signs revealed an elevated heart rate and slightly reduced oxygen levels. During the physical examination, we observed swelling in the lower legs and signs that fluid might be accumulating elsewhere in the body. We ordered blood tests, a chest X-ray, an electrocardiogram, and an echocardiogram, which is an ultrasound scan of the heart. These tests help us understand how well the heart is functioning and whether fluid is building up in the lungs or other tissues. The results painted a clearer picture. His heart was not pumping blood as efficiently as it should. Fluid had begun accumulating in his body, explaining the swelling, weight gain, and breathing difficulties.
The diagnosis was heart failure. Despite its alarming name, heart failure does not mean the heart has stopped working. It means the heart is no longer able to pump blood effectively enough to meet the body's needs. When this happens, blood and fluid can back up into the lungs, legs, abdomen, and other tissues. This leads to symptoms such as shortness of breath, fatigue, swelling, rapid weight gain, reduced exercise tolerance, and difficulty sleeping flat. One reason it's dangerous is that many early symptoms are often dismissed as normal aging, stress, or lack of fitness. So what causes heart failure?
The answer is often complex. In many patients, multiple risk factors contribute over time. High blood pressure is one of the most common causes. When blood pressure remains elevated for years, the heart must work harder to pump blood throughout the body. Eventually, this extra strain can weaken the heart muscle. Coronary artery disease is another major contributor. Reduced blood flow to the heart muscle can damage its ability to pump effectively. Obesity also increases risk. Excess body weight places additional demands on the heart and is often associated with conditions such as diabetes and high blood pressure. Poor dietary habits, especially diets high in salt, processed foods, and unhealthy fats, may contribute to cardiovascular disease over time. Smoking damages blood vessels and reduces oxygen delivery throughout the body, increasing strain on the cardiovascular system. Excessive alcohol use can weaken the heart muscle and contribute to long-term heart dysfunction. A sedentary lifestyle can also increase risk. Regular physical activity helps maintain cardiovascular health and supports healthy blood pressure and weight management. Chronic stress and poor sleep quality may also play a role. While they are not usually the sole cause, they can contribute to other risk factors that affect heart health. Genetics, age, diabetes, kidney disease, and certain infections can also increase a person's risk of developing heart failure.
For this patient, several risk factors had accumulated over many years, gradually placing increasing strain on his heart. Treatment focused on reducing fluid buildup, improving heart function, and addressing the underlying causes contributing to his condition. Medications were carefully selected to help his heart work more efficiently and reduce excess fluid retention. Throughout his hospital stay, we closely monitored his breathing, weight, blood pressure, and overall response to treatment. It is important to remember that treatment plans vary from patient to patient and should always be guided by qualified healthcare professionals.
Heart failure cannot always be prevented, but many risk factors can be reduced through healthy lifestyle choices. Maintaining a healthy weight, staying physically active, controlling blood pressure, managing diabetes, avoiding tobacco use, and attending regular medical checkups can all support heart health. One common mistake people make is ignoring gradual symptoms. Persistent shortness of breath, unexplained swelling, rapid weight gain, or unusual fatigue should never be dismissed without medical evaluation. Fortunately, after receiving appropriate treatment and follow-up care, our patient began to improve. His breathing became easier, the swelling gradually decreased, and his energy levels started returning. While ongoing management would be necessary, he was able to leave the hospital with a clear treatment plan and a better understanding of his condition. This case reminds us that the body often provides warning signs long before a serious medical problem reaches its peak. Paying attention to those signals can make a significant difference.
Thank you for joining me today. If you found this story helpful, please subscribe for more real hospital cases and medical education. Stay informed about your heart health. Take symptoms seriously and seek help. Prioritize preventive care with healthy habits, and always discuss any health concerns with a qualified healthcare professional. Your next symptom could be your biggest warning sign. Subscribe and join Dr. Linda for more real hospital stories. I'm Dr. Linda, and I'll see you in the next video.